Congratulations on your new braces. It's the first step to a healthy, beautiful smile. During the next few weeks, your mouth will be going through a few changes. As your teeth start to move, you may experience a little discomfort. Please take an over-the-counter painkiller, such as paracetamol or ibuprofen. If the pain doesn't go away, please get in touch with your orthodontist. He will have a look at you and make sure that everything is okay. It's very common during the first few weeks of treatment for the brace to rub on your cheeks and your lips. Your orthodontic professional will provide you with a special wax. Simply take a strip of the wax out of the box, break off a small piece and start rolling into a ball, and once really soft, press to a small disc, and then you can apply that to the brace, which will create a physical barrier and encourage healing. During brace treatment, good oral hygiene is very, very important. We need to control the build-up of dental plaque. Dental plaque is a pale substance made up of millions of bacteria that attaches itself to the tooth surface. It can cause problems such as gum inflammation, tooth decay, and bad breath, which we call halitosis. This short video will provide you with everything that you need to know to maintain good oral health and safeguard your orthodontic treatment. The starting point of good oral hygiene is using the correct products. I'm going to recommend Vitis Orthodontic. The Vitis Orthodontic toothbrush is specifically designed for brace wearers. It has a V-shaped furrow to clean the wire. There is a small compact head to allow for cleaning of very hard to reach areas, and a mono tip which is designed to clean around the brackets and against bands and bonded areas. The brush should be used in conjunction with Vitis Orthodontic toothpaste. This special formulation contains fluoride to help protect your teeth and make them strong, and components that help soothe your teeth and gums from the rubbing of the brace. When brushing your teeth, your gums and the brace, I recommend that you stand in front of the mirror just so you can really see what you're doing. Start by visually separating your teeth into two sections, one above the brace and one below the brace. Place the brush bristles on the gum edge and apply enough pressure to make the gum blanch slightly. Use a small vibratory round and round stroke or a side to side motion. Now place under the brace and press to engage the bristles to brush and tuck under the brackets. Then take your toothbrush and brush the biting surfaces, and then we need to finish by brushing the inside of the teeth where your tongue sits. And this is of paramount importance if you have a brace that sits on the inside. To carry out proper brushing, it's going to take about 4 minutes, and this needs to be repeated 3 times a day. After brushing, spit out your toothpaste. Try not to rinse it out, as this will rinse out the components that are doing your teeth a lot of good. The toothbrush will clean the flat surfaces of your teeth, but it won't clean the sides. So for this we have a special tool called an interdental brush. The interdental brush has 2 features to help you with good oral hygiene. The first is a long handle to help you access difficult areas, and the second is a dual coloured bristle system to help you seek out plaque and any bleeding that you might have. Simply use the smaller brush to ease in between the teeth to prevent tooth decay, and then use a bigger brush to clean between the wires. Ease the brush up under the wire on each side of the bracket and use a gentle up and down and side to side motion. The movement of your teeth during orthodontics can affect your gum health. I recommend that you use a single tufted brush. Place the brush on the gum edge at the junction between the gum and the tooth and move in very, very small circles along the gum line. It's difficult to know how well you are cleaning. Dental plaque is white and is therefore difficult to see. We would recommend that for the first week you use a disclosing tablet such as this one daily. You chew the tablet and use your tongue to spread the solution around the surfaces of the teeth before spitting out the residual amount. Check your teeth in the mirror. The darker blue areas will show up plaque that is 1 to 2 days old. The pink areas show early plaque, which is probably only 12 hours old. Your teeth need extra protection during your brace treatment. Fluoride is a wonderful chemical that provides this. We recommend that you use the Vitis Fluoride mouthwash after snacks and before you go to bed. Simply pour 15 millilitres into the cap, pop in your mouth and rinse for 30 seconds. It's as easy as that. As we know, eating a healthy diet is vital to maintaining our general health. When we have a brace, there are several things that we need to consider. In the first few weeks of your treatment, your teeth may be a little tender, and therefore it is wise to opt for soft foods. I would recommend noodles, fish, potatoes, steamed vegetables, foods that are kind and easy to chew so you can enjoy them. There are certain foods that you may have to say goodbye to for a little while during your treatment. Certain foods may stick to your brace and damage the brackets, and they may even come off. So I would steer clear of chewing gum, boiled sweets, biting into apples and pears, and anything that is hard and fibrous. I tell my patients to keep sugar-containing foods and drinks to an absolute minimum. I would avoid carbonated drinks, fruit juices, smoothies and milkshakes. If at any time your brace does break, and sometimes this does happen, please do not hesitate in going to the practice and your orthodontist will put you back together again, and this will speed up your treatment time. Professional cleaning is very important during your brace treatment. I recommend to all my patients that they see a hygienist every 3 months to check on their brushing, to make sure their gums are in good health and that their teeth have a very, very good clean.